Have you ever known exactly what you should do, like set a boundary with your roommate, and you still couldn't do it? You've rehearsed it in your head 100 times, and then the moment comes and your brain goes blank or your chest tightens and you default to, it's fine. That is where experiential therapies shine because they don't just help you understand change, they help you to practice it. Hi, I'm Nicole, and today we're talking about experiential therapies, what they are, how they work, and why they're often especially helpful if you're highly cognitive, analytical, or just stuck in overthinking. Experiential therapies are approaches that help you change by working with your lived experience in real time. Your emotions, body sensations, impulses, memories, and relationship patterns, rather than only talking about them. They often include interventions like emotion-focused work, so helping you access and then transform an emotion, not just label it. It can also include chair work, where you envision a part of yourself or another individual, or maybe even a whole system in the chair across from you and actually have that conversation with them. You have that dialogue. It can also include a part of yourself, like the people pleaser part or your inner protector. Some other examples are role play and behavioral rehearsals, so practicing that hard conversation that you might want to have in session. Another example is psychodrama. These are truly acting out different scenes to process and integrate them into learning. So it could be something from your past or something that you're envisioning in the future. It could, again, be different parts of yourself that you assign different roles to and give dialogue and words to what they would like to say if they could. This also includes sand play or other expressive arts. These are very commonly used with children, but I often use them with adults as well to visually see and represent different experiences that we can process in different ways when we can see it from different angles and represent it with different figures. The big picture overall is that experiential therapies aim to create new emotional and relational experiences, not just new ideas. How and why do experiential therapies work? One, they work because emotion is a driver of change, not just an extra. A lot of people try to change from the neck up. I can just think my way into a better choice. I'll be fine. But research-informed experiential approaches emphasize that emotion organizes our attention, meaning, and action. And therapy often works by helping people access emotions and then transform them. In emotion-focused therapy, for example, the idea isn't feel more, it's access what that emotion is, what's the intensity, what's the context, so then you can use that adaptively. Two, these experiential therapies help create corrective emotional experiences. There's a long-standing psychotherapy concept called corrective emotional experience. So re-encountering something emotionally difficult, but this time with new support, new choices, new options, and different ending. Experiential therapy makes that possible because you're not only describing the painful or undesired pattern, you're evoking it safely and at that same time updating it as well. Three, experiential therapies use learning principles, new experiences, plus practice help us to actually change patterns in real time. Many experiential methods include that practice part. So they try out a new response in session. You get feedback about it. You can adjust it right then and there and try again. That's not fluff. It's actually skill acquisition and practice. This overlaps with what we know from assertiveness training and other related interventions. Practicing assertive behaviors increase assertiveness and reduce distress like social anxiety for many people. For experiential therapies, leverage memory reconsolidation, so updating emotional learning. One proposed mechanism, especially discussed in the research, memory reconsolidation, is that when an old emotional learning is reactivated and you have new emotional experience that contradicts it, that old learning can often be updated. In translation, that's not just coping with old responses. It's helping the brain revise what it learned in the first place, especially when the work involves real emotional activation at the same time, plus a new experience. Just a side note, this is active scientific research and discussion. Reconsolidation is not a magic wand, but it is one of the clearer, testable ways researchers are trying to describe change happening in people. Finally, outcomes. Experiential therapies show evidence of effectiveness. There is substantial research base supporting experiential approaches. They're often used with humanistic experiential traditions. This is especially helpful for overthinkers. Often, if you're an overthinker, you have great insight, strong language, and a clear plan of what you would like to do in those situations. But in that moment of real stress, when your nervous system is activated and you're having those real-time emotions, often you will shut down or go blank, fawn or appease, or fight and defend. Experiential therapies help because they bring that moment and those feelings into the room so you can actually evaluate what happened. You can slow it down, notice your body, your impulses, your needs that are acting all so quickly in real time. And it also gives you a chance to practice so you don't have to perform perfectly. The stakes aren't so high the next time that you try it and want to put it into practice. You've had some experience, just like lifting weights, you're working those muscles in session when it feels a lot safer to do so. So experiential work helps you build in the moment access, not just after the fact understanding. Experiential therapies are a great fit if you intellectualize your feelings. So a lot of I think that I feel this way, or if you get stuck in rumination and looping in analyzing what happened, or if you freeze in conflict, or you understand your patterns of behavior, but you just can't seem to shift them in real time. And a good therapist will pace the work for you. If you have significant trauma history or you dissociate, experiential methods should be used carefully and collaboratively so that the work stays within your window of tolerance. So finally, if you're an overthinker, you don't need more insight. You need new experiences, safe, guided, repeatable practice that your nervous system can learn from. If you liked this video, don't forget to like, subscribe, and share this video and our channel with your friends. Thank you so much.